She had learned to save lives while bombs exploded in Afghanistan, but what she faced today was more critical than even the battlefield. Michelle Parker, 35 years old, a former military nurse. She served 3 tours in Afghanistan, saving countless wounded soldiers. Now she works in the emergency department of St. Mary Hospital. She's trying to adapt to civilian life after returning from war, but the traces of the past still run deep in her soul. Michelle's military background was heavy. In 2018, while serving at a base near Kabul, she could never forget that horrific day when a suicide attack injured numerous civilians and soldiers. That day, she had tried to save little Amedi, who was only 22 years old. The struggle for life in the child's eyes had been etched into Michelle's heart. But despite all her efforts, she had lost little Amedi. That morning, she had arrived early for her shift as usual. Walking through the hospital corridors, her military discipline was still evident in her posture. Her steps were precise, her gaze sharp. The other nurses liked to call her Sergeant Michelle, though not to her face. They didn't know much about Michelle's past, but they sensed she was different. But what Michelle didn't know that day was that the biggest test of her life awaited her. At 2:30 p.m., everything was normal. She was doing routine checks, preparing patients' medications. The nightmare-like nights in Afghanistan were now just memories suppressed with sleeping pills. Or so she thought. In last week's session with the psychologist, the doctor had said, "You need to make peace with your past, Michelle. That child's death wasn't your fault." But Michelle still blamed herself. During her lunch break, sitting alone in the cafeteria, she looked at the photo on her table. It was a group photo with her unit in Afghanistan. Half of the soldiers in that photo were no longer alive. Michelle put the photo in her pocket and took a deep breath. "Just another normal day," she murmured to herself. At 3:45 p.m., ambulance sirens were heard. That familiar sound instantly triggered alarm bells inside Michelle. Her heart began racing, her hands became sweaty. These sounds always took her back to Afghanistan. The roar of helicopters, the sound of explosions, the screams of the wounded. Michelle was breathless as she ran to the emergency room. The paramedic was shouting over the radio, "Multiple trauma! School bus accident, 15-year-old male, chest trauma, pulse dropping, blood loss at critical level." Michelle's hands began to tremble. A child. There were children in Afghanistan too. Little Amedi's face appeared in her mind. That innocent smile, that hopeful look. She gathered her breath. "Not now," she murmured to herself. "Now is the time to be strong." Emergency room nurse Sarah ran to Michelle's side. "Michelle, you're the most experienced in this. The child is in very bad condition." When the ambulance doors opened, what she saw would freeze her. The child lying on the stretcher looked exactly like little Amedi she had tried to save in Afghanistan. Same age, same brown hair, same thin build. Time seemed to have stopped. This is exactly when everything changed. As Michelle approached the child, she smelled the blood on him. This smell instantly took her to that field hospital in Kabul. Her eyes watered, but her professional reflexes kicked in. Dr. Williams's worried voice brought Michelle back to reality. "Michelle, you take this child. I'll deal with the other wounded. 4 more injured are coming right now." Michelle leaned over the child. The child was unconscious, breathing irregularly. There was a metallic piece in his chest, a fragment from the bus window. Blood loss was excessive and his pulse was dangerously dropping. Michelle began working on autopilot. Her hands no longer trembled. Just like in Afghanistan, she first checked vital functions. Pulse, 45, and dropping. Blood pressure, 80/40. Breathing, shallow. But suddenly, the child opened his eyes and looked at Michelle. The fear and pain she saw in those blue eyes instantly took Michelle back years. Amedi's last look, that helplessness, that silent cry for help. "No," Michelle murmured, "not this time. I won't lose this time." "Wait a minute, don't miss this detail." The child grabbed Michelle's hand. In a weak voice, he whispered, "It hurts." Michelle stroked the child's forehead. "I know, sweetheart, but you're strong. I'm here. I'll protect you." These were also words she was saying to herself, words she couldn't say to Ahmedi in Afghanistan, words she was too late for. The child's pulse continued to drop dangerously. Emergency surgery was needed, but the operating room was full. The nearest available operating room would be ready in 20 minutes. Michelle looked at the monitor. Pulse dropped to 35. 20 minutes. That was too long for this child. "Dr. Williams!" Michelle's voice echoed in the middle of the emergency room. "This child can't wait 20 minutes. I need to intervene in the emergency room." Dr. Williams turned in shock. "Michelle, you can't operate here. There are protocols. Sterilization is required." "Forget the protocol!" Michelle's voice was determined and cold. "This child is dying. If I did it in Afghanistan in a tent under bombs, I can do it here too. Trust me." Dr. Williams saw the determination in Michelle's eyes. This was the look of a soldier experienced on the battlefield. "Do you really know what you're doing?" "I know. In 2019, in Kabul, in a field hospital, I operated on 3 children with only flashlight illumination. They all survived." Michelle's voice no longer trembled. Michelle ran to the nurse's station and began gathering sterile supplies. Her hands were trembling, but in her mind was that night in Afghanistan. Mortar sounds, helicopter noise, screams of the wounded, but also that moment in the tent with a flashlight when she saved 3 children's lives. "Sarah, help me!" Michelle shouted. "Sterile gloves, suture material, local anesthesia." "Quick!" Sarah asked in confusion. "Michelle, what are you doing?" "Saving a life," Michelle said in a cold voice. While cleaning the child's wound, Michelle was talking to herself. "You can do this. You couldn't save that child, but this time is different. This time you're ready." When she examined the metal fragment in the child's chest, she understood the seriousness of the situation. There was internal bleeding and a hole had formed in his lung. Michelle had to apply the emergency chest decompression technique she learned in Afghanistan. "Dr. Williams, give me a needle. Large needle, 14 gauge. "Michelle, this is very risky." "I'm taking the risk. This child is having a pneumothorax. If we don't intervene now, he'll die in 5 minutes. Michelle placed the needle in the child's chest. Immediately, a hissing sound came out. The lung was inflating. The child's breathing began to improve. "Pulse is rising," shouted the technician beside her. "It's up to 70. But the job wasn't finished yet. She needed to stop the internal bleeding. Michelle applied the pressure bandage technique she learned in Afghanistan. Her hands were on autopilot, as if her body had returned to the battlefield. "Michelle, how do you know this?" Dr. Williams asked in amazement. "I learned it in Kabul. In 2019, in a field hospital, during a power outage, I operated on 3 children. One was younger than Ahmedi." Michelle's voice trailed off. "But I won't lose this time." When the operating room was ready 20 minutes later, Michelle had already completed the critical intervention. The child's life-threatening condition had passed. His pulse had risen to 85. Blood pressure had returned to normal. Dr. Williams was looking at Michelle in amazement. "Michelle, this is incredible. Where did you learn this?" he asked. Michelle, taking off her bloody gloves, replied, "In Afghanistan." In 2018 and 2019, I served at a base near Kabul. There, when children are dying, you don't learn to just watch. In war, every second you fight to save lives. "Who was little Ahmedi?" Michelle hesitated. This was the first time she had mentioned this name at the hospital. He was the child I lost. He was 22 years old, but everyone called him Little Ahmedi. They brought him after a suicide attack. I couldn't save him." Dr. Williams touched Michelle's shoulder. "But you saved one today." As the child was taken to the operating room, Michelle's phone rang. The child's mother was coming to the hospital. Michelle stood in front of the window at the end of the corridor and looked outside. For the first time since returning from Afghanistan, she felt at peace with her past. Half an hour later, running footsteps were heard in the corridor. The mother was coming down the corridor crying, followed by the father and a little sister. When Michelle met her, the woman hugged her. "Doctor, will my son live? Please tell me he'll live." "I'm not a doctor," Michelle said gently. "I'm a nurse. And yes, your son is strong. He'll fight, just like a soldier." The mother saw the determination and peace in Michelle's eyes. This woman had brought her son back from the brink of death. You saved his life, didn't you?" "I just did my job," Michelle said. "But yes, he's a strong child. The surgery was successful. Now he needs to focus on recovery." The little sister tugged at Michelle's pants. "Sister, will my brother get better?" Michelle bent down and looked into the little girl's eyes. "Your brother is very strong. Like you. And most importantly, he's safe now." While saying these words, Michelle was also speaking to the little girl inside herself, to that innocent part she lost in Afghanistan, telling her that she had finally found a safe place. 3 days later, the child regained consciousness. When he first opened his eyes, he saw Michelle. "Thank you," he whispered. At that moment, Michelle realized she had put an end to the nightmares of Afghanistan. The guilt she carried after losing Ahmedi in the war was gone, because this time she had won. This time she had been able to intervene in time. "You're a very brave child," Michelle said. "You acted like a warrior." The child said with a weak smile, "So did you." "Nurse sister, were you a soldier?" Michelle was surprised. "How did you know?" "From your eyes. My dad was a soldier too. He used to look like you too." The child paused. "Were you in the war too?" Michelle nodded. "Yes, in Afghanistan." "Did you save children there too?" Michelle's eyes watered. "Yes, I couldn't save all of them, but I always tried. Thank you for saving me. You're a real hero." The hospital administration gave Michelle a special appreciation certificate. Local newspapers wrote the story. "Afghanistan veteran nurse saves child's life with war experience." But for Michelle, the real reward was the child's smile. "You're a hero," the child's mother had said on the day they were discharged. Michelle had replied, "No, I'm just a nurse doing my job. I used what I learned in war to save lives in peace. This is what all veterans should do." That night, Michelle called her old friend Mike. Mike was also an Afghanistan veteran and now worked as a PTSD counselor. "Mike, something happened today. For the first time, I felt that my experiences in Afghanistan were used for something positive." "That's wonderful, Michelle. It means you've taken an important step in the healing process." "Yes. I think I'm at peace with my past now. Those children I lost didn't die in vain. They taught me something. How to save lives." Walking home that evening, Michelle touched her old military ID in her pocket. She was no longer running from her past. Her experience in Afghanistan had saved a child's life today. Perhaps all those pains had meaning. At home, she looked at the Afghanistan photos on the wall. Looking at them no longer hurt. Instead, she felt proud. The soldiers in those photos had taught her how to save lives. The friends they lost hadn't died in vain. They had left Michelle valuable lessons. She picked up her phone and texted her former commander, Colonel Thompson. "Today, I used what I learned in Afghanistan to save a child's life. I understand now. Our mission was the same there and here, to protect life." The reply came immediately. "I'm proud of you, Michelle. You're a real soldier. What you learned in war continues to serve in peace. Sometimes what war teaches saves lives in peace too." Michelle Parker was no longer just a former soldier. She was a nurse who had made peace with her past, transformed her traumas into healing power, and saved lives. Going to bed that night, for the first time she didn't feel sad when thinking of Ahmedi. Instead, she said, "Ahmedi, today I fought for your memory too." And we won. When she came to the hospital early the next morning, she stopped by the child's room. The child was recovering, his mother sitting beside him. "Nurse Michelle," the child shouted. "The doctor said I can go home in a week." Michelle smiled. "That's great news. You really are a strong warrior. Will you save other children now?" Michelle paused. She knew the answer to this question now. "Yes, this is my duty, in Afghanistan and here." But the story doesn't end here, because Michelle's story was just the beginning. From that day on, Michelle started a special training program for nurses with military experience at the hospital. The program, called From War to Civilian Life, Transforming Traumatic Experiences into Healing Power, became a model nationwide. Months later, a veteran nurse trained by Michelle saved numerous wounded in an earthquake zone. When that nurse called Michelle, she said, "You didn't just teach me technical knowledge, you taught me to make peace with my past." That night, Michelle realized that her pain in Afghanistan wasn't in vain. That pain had made her a stronger, more sensitive, and more effective nurse, and now she was using this experience to save thousands of lives. Real heroes are those who transform the pain of their past into hope for the future. Michelle Parker's story wasn't just a veteran story. This was a story of hope for all people who had experienced trauma. The darkness created by war could be transformed into light in the right hands. Michelle was St. Mary Hospital's most successful nurse, but more importantly, she now slept peacefully at night. The memories of Afghanistan were still there, but she was no longer afraid to carry them, because she knew those memories gave her strength. Every time she saved a life, a Medi's spirit smiled too.